modern, but it was.
So
It was fun. It was very light-hearted,
okay.
even though it was a serious treatment, obviously.
Yeah.
But and you'll always see somebody worse than you are, and I found that anyhow. But I suppose I've got a little bit of health luck in my life, because I was telling you about the heart issue I had, which was it was an arrhythmia thing, and I was getting medication for it for a couple of years. But in 2012 I went in. I had a pain in my chest. It was the only time I'd ever had a pain in my chest because of it. But they took me in and they checked me out and said, look, we're going to do this ablation. It's go into the heart and do it sort of angiogram type stuff, or not, yeah. And they burn all the little nerve ends that are causing the arrhythmia, and had an accident, and they burned a hole in my heart, the wall of the heart, and I was critical. I was touch and go at the time. So I was grand. They opened me up. I had a big scar down here, but I woke up the next morning. I was in an awful state. But that was sort of, I wouldn't have known anything about it. If anything had happened, true, I was gone. But I'm very positive about these things, and it sort of helped me then getting through the treatment. That's, as I say to the people, look at the number of days you've gone. Don't be looking at how many days you have to go. Look at the number of days you've gone, and everybody in here was really, really positive. It was really good, really good.
Besides your heart condition, did you suffer from any other illness?
No.
Otherwise,
Fairly healthy.
Okay.
Up to that.
Okay.
So everything all at once then.
And you mentioned that recently you had a chest infection?
Yes, I was. I went away to Italy on the 6th of September. I'm only putting dates on it, for a week to a wedding. And while I was there, I had a terrible cough, and to the extent that I wasn't great. I couldn't really enjoy it. It was good, but I missed out on a few things. But as soon as I came back then, I went to my doctor, and I had a chest infection, and she just gave me antibiotics, and I'm just over it now. So
okay. Yeah, that's good. And did you have any complication during the treatments?
No.
And besides this chest infection during this time?
No, the chest infection, that's one thing. As I was saying, the PSA has just gone up a little bit, but he can put that down to the chest infection. But other than that, no, we've no issues. I had what do you call it? No, I can't remember the name. I had to get a polyp removed from the
colon.
The colonoscopy. I had to get a polyp removed about a month ago, about 5 weeks ago.
Okay.
And I was sent for that by Dr. Tyrion, and so I got that done in St. Luke's, and I'm over that now as far as I know. So,
okay. And you continued with tablets after chemotherapy, or
no? When he started the chemo, I was done with the tablets.
Radiotherapy, sorry.
Radiotherapy, chemo, just that's all I want. But I was done with the tablets when that.
And also with the injections, or you?
No, the injections finished on such and such a date, and he said we'd start now. But he did say if there's any hint after the procedure that there might be a PSA issue, or it might be a little issue, and we haven't quite got to the you haven't quite achieved their target, I can put you back on the tablets for a little bit longer. But he said that shouldn't happen, but it might.
Okay.
But don't worry about it.
And it didn't happen. So
no, it
after
didn't happen.
you finished your radiotherapy,
I was finished.
You were finished with everything. What other tablets or medication are you taking?
Oh, a list. I can give you a list of them.
Okay.
If you don't mind. If you don't mind, just bear with me. I take medication for the heart.
Okay.
And I suppose most of the medication after that is related to it in some shape or other. It's I better list somewhere. I take Tambacor.
Okay.
One of them is for arrhythmia, and the other one is to keep the heart rate a bit lower.
Okay.
So there's Tambacor, like Glucosamate, which is only a stomach tablet, just for all the other medications. Aspirin.
Okay. And that is also
blood
for
thinner.
the heart.
Yeah, blood thinner. I take the Bicep or Cardicor, which is the one I think for the keep the heart rate a bit low.
Okay.
I can never understand these. I take allopurinol for gout, so which is only an occasional issue, and I take rosuvastatin, a statin for cholesterol.
Okay.
But I was told at the time I don't have a cholesterol issue, but it said it helps to keep the blood vessels clear.
Okay.
So that's fine. And then I take Xarelto, which is a massive blood thinner. So I'm on that as well. So
you take a lot of medication for your heart.
Yeah.
And
more or less for the heart. Yeah.
Yeah.
But it doesn't bother me too much. It just.
Okay. And you take this every day.
Yeah.
And you've been taking this also during your treatment.
Yes. Yeah. Okay. I took that. So.
And I'm guessing doctors also communicate with each other.
Yeah. I at no stage would I wouldn't even. I just knocked that out. At no stage would I take any new. I won't even take it. If I have a headache, I won't even take an aspirin. I won't take anything for it until I see the doctors.
Okay.
So I've no worries there.
Okay.
And even then, in my pharmacy, they will advise me what I can and can't take. So.
And you keep your list always with you?
Yeah. I wrote a better list out somewhere. I don't know where it is. I can hardly read this one now. But I keep it with me all the time, so It's just for handiness.
Yeah.
But I took all those. I was taking all those tablets constantly, and they didn't have any effect other than what they were supposed to do. They didn't cause any illness or drowsiness or anything.
So you've been more or less 1.5 years since you finished your cancer treatment. And how often have you been meeting with your doctor?
My doctor in the brewery, I told her I'd have to make a weekly appointment with her, seeing her so often. But I don't need her.
The doctor here.
The doctor here, once a month. I'm sorry, once every 3 months after the treatment. And then it's gone to once every 4 months.
Okay.
And he said then after 2 years it goes to 6 months or something like that, and they monitor then for 5 years, something like that.
And usually in these appointments, what do you discuss?
He goes through. I bring him in all the results of my blood samples.
And you do your blood samples every.
I get them done if I know I have an appointment. Maybe a week beforehand, I get them done. I get them done through the brewery, Guinness Medical Centre, and I just go in, and they keep an eye on everything then.
Okay.
So my doctor gets a copy of the results, and she'd ring me if there was anything unusual about them, but and then I just bring them in to here. And
have you done any scans since you finished your radiotherapy? No scans?
No.
Okay.
I did the only thing was the colonoscopy, and I did a scan there, but then I didn't have the operation, but that's all. Everything else
how did you go to have a colonoscopy? There was
one, I think about 6 months ago, Dr. Therion said, he was looking at my blood and he said there's a slight, I think he might have said the blood iron level is slightly low, you might be, and he said you can put that down to a few things, but he said there's a possibility that you might be leaking blood inside, and he said it's usually the likely cause. So he said we do the colonoscopy, and he sent me away to get it done, and they said there was a polyp there which seemed to be bleeding, and that's how the follow-up treatment then. So get everything done in one. But there's certainly plenty to be done, but I don't mind getting it done if it's after good. So
because these polyps turn into cancer after they go undetected.
Yeah.
But going a little bit back now during the radiotherapy, I know from other patients that at the end, or like when you come here, you need to drink a lot of water, and then it takes for a while until you go in. So that time is a little bit
is crucial. And even then you can go in on time.